Good morning, good afternoon, or good evening, wherever you are in the world. My name is Marloes Kibatja, and I'm the Managing Director at Africa Health Business. And I'm here to welcome you to our session 5 of the Africa Health Business Symposium 2021 series, The Power of Partnerships, Development Partners, Value Creation in the Healthcare Sector. Before we move to the session, I would like to share some house rules with you. As you can see on the slide, the attendees will be on mute during the session, and the session is in English. We request all speakers to keep it to the allocated time, and the total session today will be 120 minutes, so 2 hours. If you have any questions, you can use the checkbox as a Q&A section, and we will capture your questions and try to answer them as much as possible during the Q&A session. During the session, there will be pop-up questions asked, and we request you to fill them in. And then at the end of the session, we'll go through the answers. If you're on Twitter, please feel free to tweet your insights, thoughts, or key points using the hashtag AHBS2021. And the session is also live visible on YouTube and will be also available on YouTube after this session. So please feel free to register to our channel, the Africa Health Business YouTube channel. Thank you. And then I would like to move a bit to an overview about who we are at Africa Health Business. We're an Africa Health consulting and advisory firm based from Nairobi, Kenya, but our operations are spread throughout the continent. We offer a range of services, but all with a focus on strengthening the private health sector on the continent. But we work with a lot of different partners, and that's also why this session about partnerships and the power of partnerships is close to our heart. And if you are keen to engage with us or explore how we can help your organization or business move to the next level within the healthcare space in Africa, feel free to reach out to us. Next slide. This is the program for today. As you see, we have a great lineup of speakers representing different sectors of the health space, public, private, and development partners. So I'm very much looking forward to engaging with this great lineup of expert speakers. I would like to move to the next slide. That is me again, Marloes Kibatja, Managing Director at Africa Health Business. And before we start with the panelists, I would like to share a slide with an overview of how we view partnerships, and that we do through our partner ecosystem. You see this in this slide. These are all the types of partners that we work with. Even though we are focusing on a private sector strengthening and health system strengthening through a private sector lens, doesn't mean we only work with private sector. Actually, we elaborately and extensively work with a lot of different partners, such as the government, as development partners, the non-governmental organizations, community-based, civil society, faith-based organizations, more and more also with investment firms and private equity firms that want to invest in health on the continent, and not to forget the different health organizations like WHO, Global Fund, Africa CDC as we believe if you want to go fast, you go alone. If you go far, you go together, like the African proverb. That's right up our alley as Africa Health Business. And that's why I'm also very excited to moderate this session with you today and with the different type of speakers that we have. Welcome everybody, and let's start. This is an overview of our panelists that we have. You can see the Minister of Health, Wilhelmina Jalla, Honorable Dr. Jalla from the Ministry of Health, Liberia, Ms. Barbara Nguyumbo, apologies, of Sanofi Pasteur, Dr. Karim Bendau of Merck, Mr. Ian Wakefield from BD Africa, Mrs. Israt Hussein and Ms. Emily Blin from USAID, and Dr. Maureen Marty from the Ministry of Health of Ghana. I'd like to move to the first speaker, which is actually the second speaker, if I'm not mistaken. As I understand it correctly, Honorable Dr. Wilhelmina Jalla is a bit delayed, but she's joining us. Is that correct, Collins?
Yes, yes.
Okay, great. So let me introduce Barbara to you all, and then we can start our session officially. Barbara has 13 years of international experience in interactions with health authorities, think tanks, and payers for favorable environment shaping, advocacy, market access innovations, and new business models in healthcare systems. In a current role at Sanofi Pasteur, Barbara is in charge of stakeholder engagement and collaboration to create win-win partnerships towards routine immunization, new vaccines introductions, advocacy, and capacity building in Africa. I remember, Barbara, when we pre-discussed this session, we were thinking, what can we talk about? And you mentioned some great initiative that Sanofi Pasteur is engaged in, and you as well. So welcome to the session.
Thank you, Marlos. Hello, everyone. Thank you so much for the opportunity to participate here and with this distinguished panel to this important discussion indeed. I had a couple of slides, maybe if we want to run them.
And I think your slides allude to this topic that we have, the partnerships that you are engaged with Sanofi Pasteur, and I think you elaborate a bit more on that. So yeah, Barbara, take it away. Thank you.
Okay, thank you so much. Indeed, so I think partnership is at the cornerstone of how Sanofi Pasteur interact with external stakeholders, and so Sanofi Pasteur is a vaccines unit of Sanofi, and within Sanofi Pasteur we have a proud history actually of being a public health partner to sustain immunization in Africa, and quite a large footprint in Africa. I think if we move to the next slide, what is interesting is we have different levels of partnership to sustain this immunization in Africa, both with the global ecosystem and global stakeholders. So we have been, for instance, since the beginning, since the inception of the Global Polio Eradication Initiative, a key partner supplying innovated polioviruses in the past 10 years, and also the oral polioviruses, and vaccines. So I think that's one of the partnerships that illustrates our commitment. In the past year, for instance, on polio, while we were in the pandemic situation, we still supplied 130 million of doses against polio for the continent. And we know, as we celebrated last year, the eradication of wild polio in Africa, that this is still a key burden of infectious disease in Africa. In terms of routine immunization, as I was speaking earlier as well, we are also partnering with WHO and UNICEF and other international organizations to support the supply of essential vaccines against other outbreak, and being also a key partner in the outbreak controls, for instance, in yellow fever and cholera, and also meningitis outbreaks, for instance. We will come back to that, but we have also that's a key maybe topic at the moment on the local manufacturing partnership. While in parallel of the session, we know that WHO is also conducting the first world local production forum, and Sanofi Pasteur has been one of the first to also invest and partner on that topic in Africa. I think it's very interesting. I was telling that we partner at different levels. So here it's more at the global and regional level, but also at country level. So we will hear a bit later with our distinguished panelist, Dr. Maureen Modi, from Ghana. But we have for instance, some good also examples of partnering in Ghana. If we move to the next slide, maybe. Thank you. So yeah, so back to the example for Ghana. I think so now in vaccines, we can, for instance, mention that we're discussing vaccine storage capacity improvement and how a new vaccine introduction, combo vaccines, for instance, can help also address this topic. And we partner in terms of capacity building and training. We partner across the ecosystem at country level on HCP, healthcare professional training. That is often a gap, for instance, and we have committed initiatives with university, research organization, and vaccinology groups to ensure that these healthcare professionals are trained in the field of vaccinology and infectious diseases, ensuring a strong pipeline of vaccinators in the continent, because vaccine is only good if it gets into the arm of the population. Disease awareness is also something that we support and build and partner with government structures at local level to create awareness, not only with the healthcare professionals I was mentioning, but also to the lay public. For instance, in Morocco on influenza, on polio with the Ministry of Health in Egypt, and on we also partner in South Africa. I'm part of the vaccines business unit, but for instance, if we go back to Ghana, we have also other partnerships, public-private partnership initiatives that we have in also non-communicable disease, for instance, in diabetes and hypertension. Again, promoting public awareness, capacity building, provision of disease educational material and counseling to trainers and the people that are in the front line as well. I was referring earlier about the fact, if we move to the next slide, that a key topic in vaccine is the moment is the local vaccine manufacturing angle. And so this is something that we are very proud in terms of having played a key role in the past and from historically as well. So vaccine development, we know has made huge progress in the past month with the pandemic pace. But even with the pandemic pace, vaccines remain complex to produce, with 70% of the manufacturing time being dedicated to quality control. So it's very important that even with new technologies like mRNA that may refine this approach and timeline, that partners that have been long-standing in vaccines are engaged with the local manufacturer to transfer technology and knowledge and partnership. So we have been doing that in South Africa with our partner Biovac. So on the next slide, please. But it's been 2 decades of building these partnerships. So not only with Biovac, but also in terms of conducting the clinical trials on several pediatric combination vaccines, for instance, in South Africa, investing in local epidemiological studies, partnering on training and educational programs to improve the vaccine understanding and coverage in the country. These were important factors in creating confidence, equality, and relevance of the latest vaccines in the South African population. So from there, from these partnerships, we were able to build over 20 years a strong partnership with Biovac. So from the scientific training and technical assistance to quality agreement, and that enabled also the final step of technology transfer and filling and packaging of one of our most innovative pediatric combination vaccines, for instance. So this is a partnership that we are very proud of, that has been very key to sustain this type of knowledge in Africa. So, and my last slide, maybe on the last one, would be I think when it comes to partnership, it's very important to understand what is a mandate and the long-term commitment that it takes. This capacity building has specifically supported Biovac's private-public partnership with the government to develop and manufacture vaccines for South African market, but also to neighboring countries. And the key success factors were deep and mutual trust, enabling to face unavoidable challenge of bumpy road, a strong ecosystem of the local environment, from regulatory authorities with high quality standards to local authorities to support the public-private partnership. And I think it's been also a very proud moment for Africa this week, as WHO has announced the first consortium on COVID mRNA vaccine technology transfer, where BioVac will be a key local partner. So we all feel very proud at Sanofi Africa for the launch of this consortium, and having one of our historical partner being the first mover on mRNA vaccines in Africa.
Thank you, Barbara, and very insightful, and especially also to see how proud you are of your partnership with BioVac and how you support also success of your partner, even though you're both private sector players, even though I understand BioVac has a government link, but it's nice to root for each other, even though you're in the same field, your partner, you might compete, I don't know, in some areas, but still their success is your success. So that's great to hear. Just out of curiosity, you mentioned the BioVac partnership is 20 years old, and it's a long time ago, but do you know what initially got the two companies together to join forces? Was there like a common challenge or a common goal, or what brought the glue together between BioVac and Sanofi Pasteur?
That's a very good question, and thank you, Marles, for asking that. Indeed, I think so. It went back to the fact that there was a need to support the modernization of the vaccination calendar and provide equitable access in public and private sector of new vaccines. So the idea is how to build the knowledge and scientific training. So it all started with, as I was saying, building on the clinical trial, on the local epidemiological studies, and the scientific part, which is a key part in vaccines, and to move across the value chain to the supply and manufacturing part.
Interesting.
To provide new vaccines and innovative vaccines in Africa for Africa.
Great. And you mentioned clinical trials, which are done a bit in South Africa, not that much yet in the rest of the continent. What is Sanofi Pasteur's views about that? Are you open to partnering with other similar partners in maybe other countries of the continent and explore clinical trials and research? And what is the view of Sanofi?
Sure. So we had so for this combination pediatric vaccines. So we did some trials in South Africa, for instance, at the time. We also in Kenya currently also doing trials for new vaccines. So this is very important for us, this equity part, and having a diversified range of population taking part into our trials. So and still something very much and currently in the looking for us, indeed.
Great. So open for more partnerships in the field, I hear.
Yeah, and I think just to mention that Africa has also built a lot of capacities and capabilities around that. Yeah, I think we can commend the leadership of the African Union and African CDC. For instance, during the beginning of the pandemic, with the whole the CONVAC, for instance, the consortium on clinical trials in Africa that they put in place. The genomic studies that enable, for instance, to see very early on the variants. So I think that's also something that is important to mention, that Africa has a lot of great capacity and capability, and it's all working together that we can keep improving and enhancing this capacity.
For sure. Thank you so much. And for this overview and the openness to your partners and towards more partnerships. I think that collaborative attitude is what drives the change in the African healthcare space. And it's great to see a big company like Sanofi Pasteur being open to doing more in that regard and create more impact, but already doing a great job in the field. So thank you so much. We'll come back to you in the Q&A section. And if you have any questions for Barbara, feel free to add them in the chat box. You see a pop-up coming now actually at the moment, which is a pop-up question, and those results will be shared with you at the end of the webinar. So please fill it in. As soon as you filled it, the box will go away. And before we move to our next speaker, we would like to share this video with you, which actually introduces the company that the new speaker or the speaker represents, Merck. So please play the video.
This is life. A moment of joy. A dream come true. All pure love. A tiny breakthrough. Maybe a triumph. A constant struggle. A clash of ideas. We can make a difference. Create the new, the unexpected. Leading us to feel great, strong, simply human. Constantly questioning, are we curious enough? Could we be closer? Can we?
So that's an intro of Merck. And on behalf of Merck, I would like to invite Dr. Karim Bendao. He heads the Africa Bureau and coordinates all of Merck's corporate, strategic, and executive decisions in Africa. And he's a real PR pioneer, and he has been working in the pharmaceutical industry for almost 22 years, building up strong Pan-African organization and partnerships in health. He's passionate about Africa and highly committed to driving the continent forward, helping through public-private partnerships to lead the improvement of healthcare with a focus on digital technology and adoption of innovative ideas. Karim, welcome.
Hello, Maros. Thank you very much for the invitation. 22 years already.
Yeah, time flies, huh? When you're having fun. So thanks for being here. And when we were discussing this session, partnerships and Merck, your role at Merck at an African level as well, you mentioned also that you're quite involved in the development or the positioning of Africa in terms of vaccine manufacturing on the continent and increasing that capacity. What exactly is the role of Merck in that process? And maybe can you elaborate a bit more about that process, what the status is, and how you engage with the different partners, who the different partners are? Basically, shed a bit more light on the vaccine manufacturing partnership discussions that are going on at the moment.
Yeah, thank you, Marlos. I mean, we as Merck, we have, we are a science and technology company, not this classic pharma company, and we have solutions that we can provide, with disposable bioreactors. So we have several technologies that we can immediately put in place in Africa. Despite this, and I started to promote a bit these possibilities at the level of the governments, and I tried through several agencies, but nothing was really happening there. We found it not very easy. I mean, even if you have the full equipment, the full technology ready for the transfer, it's not easy to create kind of a real ecosystem in a country. And we faced several issues. One was a regulatory issue, because in such an investment, you have economy of scale. And then immediately they ask you, do we have enough customer? Is it a profitable project? Is it a sustainable project? So immediately you say, no, you need 200 million, 300 to serve 200, 300 million population in order to be really profitable. Therefore, we have this regulatory barrier immediately. That was the first one. That's why I'm now one of the soldiers, a soldier of the AMA, the African Medicine Agency, and I'm promoting quite, and I'm doing quite a lot to make sure that this is going to happen. Yesterday or 2 days ago, we had a big meeting with the minister and key stakeholders around the topic of the AMA, and I think that there Michel Sidibé is doing a tremendous job, and we will see very soon, the ratification of at least 25, 26 countries, which is a very good, very good achievement. Second barrier, the financing. If you are in the fill and finish, you are in $25 million investment. If you are in full process, you are 100 plus million investment, and then you have to convince all the financing bodies, which is not easy. So if you try to do things by yourself, this is not going to happen. So we have really to go all together and focusing on one objective, which is to make sure that Africa can get very soon. I don't mind about the countries where this is going to happen, but we'll get soon an African vaccine manufacturing capacity. So technology is there. I would say, especially in the midst of this pandemic, governments and head of states are also really looking to have this vaccine manufacturing plant in their country. Despite that, the process is still slow. The Africa Union and the CDC, they have organized in April, I think, the 11 and 12 big virtual event around this topic. They have decided to create 6 vaccine manufacturing plants in Africa, and it's still not really happening. It's moving on, but we don't have something very concrete. I remember very well, because I have to share with you this case. Where the power of partnership is key, and it's very important. I was traveling quite intensively in Africa, and I met this neglected tropical disease, the schisto happening, and killing children and adults. And the treatment was so easy to get. I mean, it was about a tablet of praziquantel, which is at the end of the day one of the cheapest products in the world, and easy to produce. So I wanted to go for a donation program about tablet, and when I tried to set up the rollout of this program, it was easy to produce it in one of the Merck factory for the donation. But how can you organize it? And then I went to WHO in 2007, and we discussed quite a lot and intensively the way how we can do it. And after 3 or 4 months, we came out with a plan. And can you imagine that until now we have been able to treat more than 300 million children and donating more than 1 billion something tablets. But without the support of the local NGOs and the faith-based organization, without the support of WHO, I was not able to make sure that those tablets will treat the children in school age, at the due time. So nothing can happen if you want to do it by yourself, I think, especially when it comes to health. And that's why I strongly believe that we should now put in place a kind of diplomacy of health. And this is the most important, because pandemic will happen again and again, and it's not the first one and it's not the last one, but the cycle is now very short, was shortened for any reason. I don't, we have several scientific explanations, but we need really now to see good experts in diplomacy of health, because it's multi-stakeholder, it's multilateral, it's it should be also extremely, it is an extremely sensitive topic, as we noticed during this pandemic.
Yeah, you mentioned health diplomacy, and of course, Merck is a big global name, right? Well known. So maybe partners like WHO or governments don't need a big introduction. They might know you, but I think in terms linked to health diplomacy is a big part of that would be trust. Because how do you make sure that people you would like to work with or organizations trust you? And what would be your advice, maybe for smaller organizations in the health space? They also like to partner with partners like WHO and governments. How would you advise them to go about it? Or what worked for you or what didn't work? What are some lessons learned in the process that you've gone through in terms of partnerships and also in regards to health diplomacy?
Yeah, I mean, the global health diplomacy focuses on globalization, this economic interdependence, the social justice. The health diplomacy can also help sustain peace and economic stability in this globalized world. And it should be a mechanism to avoid conflict and to augment health, peace, solidarity, and multilateral cooperation. So it's basically an expertise, a new job that we have now today to promote, and we need, and I'm sure that all over the world we have profiles which can fulfill, this job. And I don't know if you are angry or not, but I'm personally angry against this asymmetric, vaccination progress in the world. This is not in terms of solidarity, in terms of justice, it's not acceptable for several reasons, but it's happening. And, we have to explain to the countries which are happy to have vaccinated 60 or 70% of their population, that if they forget, the rest of the population in the world and the emerging world, new variant, a new recombination, a new combination of variant will pop up, and most probably the vaccine will not be any longer efficient, and then they simply lost the 60% of progress in vaccination. This should go in a very, we have to be equal in terms of vaccination. Even if you go to 3, 4, 5% progressively, but we have to do it worldwide and globally, and to not simply think that it is a competition between countries. And there, the diplomacy of health should play a role, because it's kind of information, we explain, put people around the level and said, okay, it's nice, your country now is at 70%, congratulations. But what's about, I don't know, your surrounding countries? If they are at 20 or 50, 20 is already good. If they are at 3, 4, or 5, I mean, it's almost useless. Something wrong gonna happen soon. I mean, we are now seeing some new variant, strange variant in Vietnam, which is the Delta one, formerly Indian one. I don't know which one, but we have a new variant which are apparently really resisting to the vaccine, if we can say so. So that's really, and it's all about partnership. It's all about partnership, and we have to do it globally and equally, and in a very keeping in mind, this solidarity and this justice, so social justice.
Yeah, interesting and very true. And just to go back to your discussions in terms of the vaccine and the manufacturing discussions you've been having on an African level, what is your expectation in terms of timelines? You mentioned it's going slow, yeah, of course, slower than that we wish. AU and Africa CDC are planning this event with topics to maybe spearhead the implementation. But based on your experience, your gut feeling, how long do you think it will be before we have the first COVID-19 vaccine manufacturing plant on the continent?
That's a very, very good question. Thank you, Mohammed. Let's go back to the basics. For us, the biopharma industry, and I'm here speaking on behalf of the colleagues because I'm the chair of the IFPMA, for Africa. The big bottleneck is the fill and finish. So Africa, we should start immediately with, 10, 12, 15 fill and finish units spread out throughout Africa. And at least with this, we can solve part of the problem. We need this stepwise approach where we start with fill and finish, and it requires, to answer your question, between 18 and 24 months to have fully ready to use fill and finish units. So it's not huge, 2 years, it's nothing. And then starting from that point, we go for the full process, and this will require maybe most probably another 3 years. So that's a bit the time frame that I have in mind, but also technically, several companies are ready to provide such a kind of fill and finish unit for vaccines or for bio products anyway. That's fair.
What is the bottleneck at the moment? Why is it not being done right now? Is it the regulatory and the finance, like you alluded to in the beginning? Or are there some other things under the surface that is preventing the quick turnaround time in this regard?
I'm still landscaping a bit what is happening really, and understand where are the. It's not even, it's barriers. It's not bottleneck, but I don't understand why, because all positive energies are there. Boards are asking, financing institution and financial institution are saying yes, we finance. Technology, multinational companies, we are ready, okay, we transfer technology. And I see people discussing IP waivers. It doesn't make any sense. Okay, I give you the IP rights. What can you do with it? If you cannot produce vaccine, you put things on the other way around. Let's start to discuss capacity. And then, yes, okay, if you have you have the capacity and you cannot produce a vaccine because of intellectual property rights and you are in the middle of a pandemic, then discussions about this topic is happening. So I'm asking politicians to focus on making sure that we have enough fill and finish units in Africa as soon as possible in the coming 24 months, and instead, paying attention to, I don't know, it's respectfully, but it is my opinion. It is too early to discuss IP levels about vaccines.
Yeah, I agree. Thanks so much. These were my questions for now, but we'll come back to you in the Q&A section. I'm sure there are more questions for you. Oh, good timing. Pop-up question is on your screens. Please fill it in and I'll handle the results at the end. For now, thanks, Karim. We'll talk to you later. Very insightful and open answers. We always appreciate those insights. So thank you very much. Before we move to the next speaker, we would like to share a video about the company of the next speaker, BD.
We're behind you every single day. It's why long before COVID-19, we helped wage battles against polio, tuberculosis, and HIV. It's why we're in this fight right now, and why long after, we will keep doing our part in support of human health. It's what we do. It's our entire reason for being.
So now I would like to introduce Ian Wakefield, the General Manager of BD Africa. Ian has extensive experience in working in the health sector in Africa and has built a rich career in the pharmaceutical and medical research field. He joined BD 9 years ago and has been a general manager for BD Africa for the past 4 years. In his current position, Ian is responsible for spearheading the planning, development, and implementation of results-oriented strategies to advance BD's business goals for the region. And he is passionate about advancing healthcare in Africa and believes that through public-private partnerships, a more efficient health system can be developed to deliver better quality care to African patients. Ian, you're welcome. Great to have you here.
Very good to be joining the panel this afternoon, Marlies.
Great. And we discussed with your team the Labs for Life partnership, and through the slides that you are going to share with us, I'm very eager to learn more about these partnerships and what your partnerships looks like. How do you improve laboratory quality and capacity through the partnerships? So please feel free to take it from here and give us more information about the partnership, what it looks like, what your role is and the role of others, and the impact you have achieved so far.
Again, thank you for the opportunity. I think I'm going to be speaking about Labs for Life, but it's more as a platform from where BD has seen success in partnership and implementation. But I think it's what is really important to do is in the context of where Africa is right now. There's a growing need for access to quality healthcare. There's a growing need from ministries of health to introduce universal healthcare. But really underpinning all of that, there's a lot of data to show that, especially in the laboratory space, that care is fragmented, systems are fragmented, but really it's key in terms of both diagnosis and prevention, especially in the public health space. So labs are passionate as from a BD point of view, and it's something we've been involved for a while. If we go to the next slide, please. The Labs for Life program, I think it's probably where BD has been involved in terms of successful partnerships in this space for more than 15 years, involving multiple countries, involving multiple stakeholders. But I think what has been key is how we've taken the learnings of this and taken it into other spaces to I think, ensure successful execution. Because especially in the developing markets and developing world, partnerships are really key to success. It's very difficult to do it alone, especially when addressing public health need and where public health capacitation is absolutely critical. BD started this path, and I think in the context of healthcare delivery in Africa, if you go back more than 15 years in terms of the HIV epidemic, really recognizing that there's both a great need, I think, from external players, but also as a company together with ministers of health. If you wanted to make an impact, you needed to find a different way to do it. And BD worked very closely with the CDC, PEPFAR, to launch Labs for Life, but really critical for that was really the partnership with local ministries of health. And we've done this partnership across multiple countries, starting initially within Kenya, Ethiopia, Uganda, and Mozambique. And in 2012, expanding it to South Africa, as well as India. And more recently, in 2018, we've extended this partnership into Rwanda as well. So this really speaks about a length of time being invested in partnerships, invest in a length of time, I would say, building credibility around driving successful partnerships and creating value. But most importantly, what I will share is how we've created impact within the space. Because partnerships is often about bringing different players together and recognizing that only together they can do more. So we go to the next slide, please. So in the recognition that I would say the lab space in Africa, both fragmented, but really key to delivering and really addressing key public health issues. The Labs for Life partnership really brought kind of big global players together, but most importantly, the ministries of health in key countries. PEPFAR came to as from the partnership provided funding, but also looking at supply into country from essential lab services point of view, especially looking at the HIV space. The CDC, both from a US as well as Africa CDC point of view, looking at bringing lab expertise, training, and really identifying the key trends in terms of disease management and the need to monitor patients to improve their outcomes going forward. BD, through its global health, I would say, arm of the organization, where we've really, through more than the period of time, 75 global health fellows, really providing key mentorship programs to different layers of the lab segment to really say, well, how do we lift and capacitate to make a difference in terms of the lab setting through partnership? What is critical in terms of any successful partnership is what is the commitment at a local country level? And really key was here what the gaps that the local ministries of health identified, and most important, their willingness to invest and to ensure that the partnership was sustainable, but also it could continue post the initial phases of identifying what the issues are, what the changes need to happen to drive success. We go to the next slide, please. And what I'm going to be sharing here is that and these are just some of the countries which have been involved in: Ethiopia, Kenya, Uganda, and Mozambique. But it really involved very closely, while you're bringing the external players to form the partnership that the local country needs. And Ethiopia, and I think we speak about healthcare delivery, but when you're looking at addressing the HIV space and you're doing follow-up of a patient that's on ART, the fact that through looking at improving the sample referral network, so how does the sample get from the patient to the lab for testing and getting the result back to the patient? In areas like, for example, ADIS, reducing the time to results from 7 days to 2 days. That means a clinician can treat the patient faster. How was that done? Firstly, geomapping the incidence of HIV in country, looking at what the sample referral route was, looking at how to transfer samples safely and effectively, maintaining stability. And the Ministry of Health actually finding the best method to actually transfer samples was using the local postal services rather than having independent referral network. Bringing all of those expertise together, both putting in place a sustainable long-term solution, and through that improving patient care for both TB patients as well as HIV patients. Similarly, for example, in Kenya, what you were able to identify that in terms of the phlebotomy space, the patient draws, how does that get improved? And again, investment in both training program, sustainability, and QMS systems, significantly improving the overall performances of the lab. What are really key to these success factors is, one is all of these are now published data. So it really, in terms of the why, the how, and the outcome are referencing in journal publications right now. So it can provide a reference point for other partners or other clinical players in the healthcare space. But that, and again, it provides the level of credibility around the why, but also the fact that from a BD point of view, we've been seen to be impactful in a number of different areas. And some of these are purely non-product areas, but does create and capacitate in the public healthcare space. And through that, creating a longer term impact. When asking the question is, what is the power of partnerships? So these examples may have been addressing a need in the HIV space or TB space. But importantly, if you're looking at the pandemic like the one we're just looking at now, COVID, weak laboratory systems really undermine the efforts to combat disease across the continent and to respond to pandemics. So having these partnerships in place, building up infrastructure, actually makes the ministries of health as well as laboratories, puts them in a much better space to respond to pandemics going forward and to support the outcomes driven through specifically looking at specific programs going forward. And I think that's been key, that one means forming a partnership to address a specific issue, the learnings that can be applied in other areas. And this has really been the model for BD. While we've been successful in the Lab for Life programs, the learnings we've now applied in other areas like AMR, like safe infection prevention and control, and partnerships in other sectors to deliver care. If you go to the next slide, please. What is really key for us, it's actually, we speak about BD fellows in terms of advancing the world of health. And the key role that more than 75 BD associates acting as mentors, going into new countries, forming partnerships has really kind of enhanced the purpose of BD, making a difference. So being part of an organization where we manufacture great products, but actually in a personal way, by being part of these programs, you can deliver care, make a difference in patient life. And I think that has added to associate value and bringing together the personal purpose that individual associates have, the company purpose, but through the partnership, really expanding, creating synergy in new spaces going forward. The next slide, please, and then I'll take some questions.
I think that was the last slide, Ian. This is a nice clip from Tanzanian students. I like to see Tanzania. My husband's Tanzanian, so whenever I see the Tanzanian flag, my heart makes a bump. Also, thank you very much. Especially the last thing you say really struck me, making the personal commitment or drive, link it to the company drive. Participants, please see another pop-up question. Please fill it in. But before we move on, I'd like to ask you a question, because you stressed several times that the key strength in the partnership is also the local ministry or local government commitment that you have in the 4 countries where this Labs for Life partnership is implemented. How did you ensure you got the trust and the buy-in from those local governments to implement or to move your project to the next level?
I think so. One is that I think when you're involved as a commercial organization in a partnership, there's always a question around what is your motive. And I think one of the key areas that BD established within its organization, the global health function, a non-commercial part of the organization. So we're not speaking about revenue, we're speaking about making a difference. And I think our willingness to invest over time to really understand healthcare needs. And I think the fact that at a global level, we've been able to build that credibility has helped us to transfer that to a country level across different countries in Africa. And it's not just across Africa, we're doing it in India, Latin America, and many other spaces. I think that factor that you've done it over a period of time, and you've done it in a way that you've shown the intent by the partnership is to make a difference and impact in patient lives. That has opened many more doors in other partnerships, because Labs for Life is kind of one stream, but we've done that, as I said, in terms of hospitals in Kenya, in terms of, I would say, safe infusion practice, training in safe injection practice. So there's other spheres that we've been able to use this as a reference point. But I think building the credibility does not happen overnight. And I think organizations and countries have to see your commitment over time, because it's about building the trust.
And how do you deal with different countries, different government systems? Some have devolved governments like Kenya, some maybe where you need to work through the national government or get national government buy-in. In all those 4 countries, did you first go in at a national level, present the idea, and then move to the subnational level? And how did that work? And did you already have in mind at a subnational level who would you like to work with? Or was it a suggestion from national government that came to you work in these areas? Or how did that process just practically happen?
I think one of the plus points, I think, which helped us in this discussion, that we've got an Africa footprint from an organizational point of view. So these are often, while we have many folks, we base out of Franklin Lakes in the US. So while we have support within Franklin Lakes, we also have a local infrastructure. So to speak to ministries of health that understand the culture, that understand the healthcare setup within countries. But it does start with national levels. And once you have that buying, it's much easier to roll out into the kind of subnational level. But if you have the commitment at the top, for example, in Mozambique, once you rolled out the QMS system in country to improve lab quality system, if the Minister of Health globally is willing to invest into QA officers to continue that program, that allows success. So it's about national and then going to have the layered approach, I would say.
Nice. And that also links into the question about sustainability, which you also mentioned. How do you ensure sustainability? Is eventually the long-term goal for government to take over, or is there a prolonged role for BD and other partners in this process? What is the sustainability strategy behind the partnership?
And I think it does different, I think, from one program to another. So one of the things you can see within the Labs for Life, it's been more than 15 years, but the aspects we've directed are very different at a country level. What ensures the same is sustainability, the fact that while we've done the partner, now I'll take the Kenyan example. While we've done the partnership in Kenya, we've worked with improving the kind of QMS system within labs. We've invested in, I would say, a training facility, but that is now at Kemri in a government institution. And so I think if you're able to do that and get local buying along the way, when you step away as a company, there's continuation, and that allows sustainability. We're always there for support, but we're not dependent once the program has been successfully implemented to make sure it continues going forward. It's about the local ownership and drive at the end of the day as well.
What is some, maybe 1 or 2 challenges that you have faced in rolling this project out? There's a lot of success, but no success comes without a challenge, right? So what is the challenge that you overcome throughout the years in this partnership model?
I think, as I said, the first challenge is how do you be seen as a credible partner, and working through that. And I think there's challenges both internally and externally. And always I say, if you're a commercial organization, why are we doing that? How does it make a difference? And I think so. It's one of the work is really making sure we have internal alignment because at the end of the day, business is what funds these programs and how we generate sufficient funding for that. So that is having that in alignment. And I think while we're doing this partnership, there are doors that get opened from a business point of view. There are connections that get made. And I think that's a huge plus from a corporate point of view. So these partnerships at the end of the day are win-win situations for the country, for, as I said, CDC, because they're seeing improvement in patient outcomes, which means less days in hospitals, less days on treatment. And that, in essence, is a plus from a local Minister of Health managing a budget, managing spend at the end of the day as well.
Yeah, no, I like that. And I also like that honesty about opening doors. You know, in the end, you are a business. You need to make a return. You need to be sustainable as a corporate. So the fact that too often, in my view, businesses are being approached for CSR, and then the profit or the opening doors from a business angle point, I think is key in order to be sustainable in any CSR that you do. So being open about that, I don't think that's a bad thing. It's a sustainable and transparent thing to do. So thank you very much for also mentioning that, the win-win part about it. And I think it's good to acknowledge that and not to be, you know, how do you say, not just to acknowledge it and to be open about it, because I think that's in the long haul what creates real results and sustainability in partnerships, and also for you as a business. It needs to make business sense in the end, because that's what makes things come, that makes innovations come, that gives money for jobs and researches and reach. So in that sense, I think that's a real key point that I appreciate you added into the mix. I think for now, I've asked my questions that I had. I have more questions, but I think they'll come up in the Q&A, and I'm sure a lot of our participants also have questions to ask you. So thank you for now, but we'll see you in the Q&A section back. Participants, please see the question in the pop-up coming up and answer it. And then I would like to move to the next speakers from USAID. It's two lady speakers, and I'm very happy that they are here, Ms. Israt Hussein and Ms. Emily Blin. Emily is an innovator advisor at the Center for Innovation and Impact, and she has built her career exploring the intersection of business, global health, and innovation. And in her current role, she helps to identify high-impact global health innovations and supports them to scale while working to embed innovative tools and approaches across USAID's Global Health Bureau. And Ms. Israt Hussein is an economist and currently in a senior capacity at the USAID. And prior to joining USAID, she worked at the World Bank for more than 25 years in technical and managerial positions. So I think we have two key experts here from a partner not to be missed, USAID, very vocal or visible and key in the African health space. Welcome, ladies.
Thank you so much.
Israt, welcome as well. And when we discuss this, because it's a dual presentation, we came up with some topics, and I believe the first part will be handled by you, Israt, and then we'll move to Emily. And the first question I would like to ask you is, how does USAID think about partnering with the private sector? I've seen a lot of USAID movement coming up in terms of sustainability, private sector engagement, and the role of that. And very keen to hear more from you about your views and USAID's views about private sector engagement, and particularly in the field of global health.
Thank you so much. First of all, I must congratulate you for organizing this meeting. And I am attending this meeting just after having several days of discussion with WHO Afro. They organized a meeting on data revolution, health status transformation, and the role of artificial intelligence for health and pandemic preparedness in Africa. And throughout the discussion, I was thinking that how crucial is the private sector in all this effort. So first of all, I very strongly recommend a discussion between you and WHO Afro to see that moving forward, how the private sector can contribute to these efforts.
Thank you. Yeah,
That's just a pitch for WHO APRO collaboration. But then on the question that you asked, I would like to point out that the USAID had developed a private sector engagement policy, and that was a few years ago under the previous administrator, Mark Green. Now, I do not know how far people remember that policy and how far it was disseminated, but I'm sure that some of you must have seen it. So this policy was based on two facts. First, what happened in one part of the world has profound effect on the other, and no longer we live in geographical, epidemiological, or developmental silos. And this point is becoming increasingly important as we see the spread of COVID and other epidemics. And then the other one was that no one stakeholder can change either the health indicators on its own or control the epidemic if it happens any part of the world. So the only solution to the current and the long-term problems is the partnership of all stakeholders. So the policy, I think, now coming to the private sector, the policy promotes enterprise-based development and market-driven solutions. And that is extremely important because of the fact that you cannot have enterprise-based development and market-driven solution without very close collaboration with the private sector. So you will see on this chart that this is the approach to the private sector engagement, that when we start a program, we have to ask the following 5 questions. Can the private sector solve the problem by itself? Could there be market-based approaches to address this challenge? What are the roles and interests of the private sector in this particular issue? Are there factors contributing to the private sector involvement or inhibiting private sector involvement? And is there a role for USAID to help solve those problems which are inhibiting private sector engagement? So that was the crux of the policy. And then I think on the value proposition as to what we will gain from this partnership, there were 5 dimensions. First was, next chart, I don't know if you have the chart, but I will talk about, yes, this is the chart. So the first dimension is the scale, sustainability, and reach of the reach through the various services through public-private partnership. Then the second is, can the activity contribute to the policy improvement or restrict the policies which have adverse effect? In other words, ability to influence policies. Then does it promote innovation, expertise, and capabilities of the private sector? And then does it allow flexibility and rapid pace of implementation? And finally, the bottom line is, does it improve efficiency and effectiveness? So that has been the approach that USAID has taken toward the private sector development, and that is what is being followed by the missions in the field, as well, of course, at the headquarters. And there are several very, very favorable results, because I see every day that there are new programs and activities that the mission is carrying out in collaboration with the private sector. So there is a very strong commitment to the private sector partnership, both in the field as well as in the headquarters. And there are a few examples. So I will request my colleague, Emily, to talk about those.
Great, thank you, Ishrat. Welcome, Emily. And I think, yeah, you'll share a bit more information, especially about COVID-19 and how USAID has worked in those partnerships. So yeah, please take it away. Looking forward to learning.
Great, thank you. So as Ishrat said, private sector engagement is core to the agency's approach to development, and specifically within the global health sector, and has been for a long time. I wanted to talk through today a couple of examples of how we've partnered with the private sector in response to COVID-19. And so this first example is through our long-standing partnership with the Coca-Cola Foundation, with the Gates Foundation, the Global Fund, in Project Last Mile. And essentially, over the past year, South Africa has had active private sector demand for PPE, for personal protective equipment, during COVID-19. And the government already had a registry of SMEs that they thought might be primed to pivot to produce PPE. And so PLM was able to access that list, identify 6 high priority SMEs that they could support to pivot, and helped them with funding to make that pivot. These were SMEs that were judged to be too risky for commercial capital, and too small for public procurement contracts. They're in that, the famous missing middle. And so leveraging FCDO funding through Project Last Mile, USAID South Africa helped them to pivot to PPE manufacturing. And so these were things like masks, but also other supplies like filters, nasal swabs, and ventilator filters. And the funding was used for training, to purchase raw materials, equipment to certify the PPE, et cetera. And these companies are still producing supplies, which will be helpful in this third wave that South Africa is experiencing. In fact, through this project, it enabled the first ever lab in South Africa that can certify PPE, and so really, a sustainable result. And just in terms of impact, in the first 6 months, these 6 companies produced 2 million units of PPE, and were able to create over 500 jobs. And in terms of the funding, it was 3-to-1 leverage. So with the grant capital from FCDO of 500,000, it catalyzed a 1.5 million in additional commercial investment. So that was an exciting example out of USAID South Africa. A similar example in Ghana. So the USAID mission in Ghana became aware of Total Family Health International, TFHO, which was helping to scale up PPE and sanitizer manufacturers for local production. And so they worked with local garment manufacturers to manufacture PPE to pivot, as well as alcohol distillers on sanitizer production. And through a $1 million grant, it enabled these producers to purchase equipment, to scale up production, to do training, and TA on producing these new materials, as well as kind of helping them through the regulatory and approval and QA process, as well as marketing and selling to make sure that pricing was appropriate and distribution channels were in place. So those are two examples, and just one more I wanted to talk through here. If you wouldn't mind going to the next slide. Great, thanks. So I think as we all know, private healthcare clinics have been really facing a crisis, particularly since COVID-19. Their revenues have dropped 40% since March of last year. And given, people's hesitancy about visiting medical facilities, as well as government lockdowns, which have restricted movement, there's been a reduction in footfall to private healthcare facilities. This, in combination with tightening of lending criteria, it's really been a crunch for private healthcare facilities, many of which are in, again, this missing middle, which are too large for microfinance and too small for commercial lending. And so USAID helped to structure a new guarantee, a new facility to help support private healthcare during the pandemic. So the PMI, the President's Malaria Initiative, put in $750,000 with a 2-to-1 investment from the Development Finance Coalition, and was able to mobilize a guarantee of $20 million from the Health Finance Coalition, which is made up of the Rockefeller Foundation, Skoll, and others. And that will enable $35 million in working capital loans for private healthcare companies on the continent, to allow them to stabilize over the coming year. And so this is called the Open Doors Africa Private Healthcare Initiative. The acronym that we're using is ODAFI. And the hope is that this will enable about, on average, $15,000 per facility, which would translate into around 1,600 facilities that could be supported, an estimated 5 million patients that could benefit, over 50% of which are projected to be low income or very low income patients, and about half women. And so really, really excited about this initiative. Thanks.
Thanks, Emily, and especially also with the link that you added to the last slide where people can go if they would like to apply. What is the interest rate on those MCF loans for healthcare facilities, percentage-wise, or what are the conditions?
I will have to get back to you on that one.
No problem. Then I had another question, because in the last, for the MCF, it was clear how to partner. But when you elaborated more on the COVID-19 partners in the slide before that, for example, the Ghana partnership, how did that come about? Did the TFHO in Ghana reach out to USAID or to FCDO, or did you reach out to them practically? How did it came into existence, basically?
Yeah, so USAID we're always talking to, in DC, we're always speaking to missions to understand how we can better support them. And so in this scenario, we became aware that TFHO was already trying to support some of these local manufacturers, and could use some partnership. And so I think it was a collaborative opportunity that came up, and realized that we could help them to scale. Oh, sorry, Marlos, I think you're on mute.
Sorry. If I was an implementer on the ground in, let's say, Malawi or Kenya, and I wanted to work with USAID and explore the opportunities to do grant funding or to do work together, what would you advise me to do? Go to the mission or go to the DC side, or what is the way to go?
First and foremost, you have to go to the mission. We don't do anything unless we have discussion with the mission and they have discussed that with their counterpart in their countries. In other words, that get all the details about implementation and the results and so on. So I think that first have to go to the missions. I think headquarters would not, if they came to us, we will go back to mission. So I think it will be better to go to the mission first.
Yeah, get national buy-in first before it can be scaled up. And I guess
the mission decide whether they should come to headquarters for further analysis or whatever, but otherwise most of the resources are utilized by the mission itself, and they don't have to come to headquarters unless it is a very controversial and sensitive issue. So there's a lot of autonomy at the field level.
And in terms of private sector partnerships, what is your need from private sector in terms of establishing trust or credibility to identify this is a credible partner, a potential partner? What are some of the selection criteria that I assume that the country missions would take? What is the due diligence process, so to say, or some key factors as a private sector player to have prepared before we speak to a mission, for example?
Actually, I think if you can just go back 2 slides, this is, a really good list. So I think, sustainability and scale and reach are really 3 things. First and foremost, the ability to contribute financial resources and making sure that this is a solution that will be sustainable, that is grounded in, shared value, and market-based solutions that will be sustainable, I think is really top of mind. And then I think just in general, 3 qualities that we admire and value in the private sector are just this ability to be innovative. So how is this different from existing solutions that are out there and better than existing solutions that are out there? How quickly are you able to move? I think a lot of times, especially now, we're in emergency situations and need to move quite quickly. And what is that? What is the flexibility that the private sector brings? I think with big organizations like USAID, to really appreciate that ability to be able to be flexible and to modify the approach over time.
And I will add that these 3 factors are important because they create trust. I think trust is the key word as far as the partnership is concerned. And therefore, I think that the private sector should be aware of the fact that they have to create an atmosphere where the public sector can trust, and vice versa, actually.
So would you say when you're a private sector player and you have a great idea or an implementation you would like to scale, maybe with support of USAID, you need all these 5 key pillars? Or if you have 3 out of 5, that's also okay? Or how critical or how key is it that you have parts of this, or the complete set needs to be available?
No, I think that it will all depend on the situation. I think in some situations it is really and also would depend on the government priorities. What is the government priorities? Is the government giving importance to scale, or the government is giving importance to the policy changes? So it all depends on the situation. And no, all of them are not critical, but in each situation, one has to see which factor is most important to move forward.
Okay. Very interesting and very clear. And this list, I think, it should serve as a checklist for anybody who would like to partner with USAID, that before you go there, make sure you have thought of this. Thank you very much. And we'll come back to you in the Q&A section as well.
I would add that these are good development principles also. So they are not really separate from anything else. So they are in the context of overall development.
For sure. Not only actually applicable to USAID work, but to general work you want to do in the health space and reach impact and scale. So for sure, yes. Please answer the pop-up question if you can. I would like to move to the last speaker of today, last but not least, Dr. Maureen Marty. You are welcome. Dr. Maureen Marty. Great to have you. Just as an introduction, Dr. Maureen Marty is a public health physician specialist and the head of resource mobilization at the Ministry of Health in Ghana. And she is responsible for engagement with bilateral development partners and the private sector. She has several years of experience working within the health sector in public health, policy development, partner engagement, private sector engagement, and public-private partnerships. So all in all, you have seen all in terms of partnerships I think all different stakeholders, private, development partner, I'm sure NGOs are part of it, with the Ministry of Health. And I'm very curious to hear from you in terms of your role as a Ministry of Health official, as your role as a stewardship, and to create the enabling environment for all stakeholders to play the game, basically. And my first question would be to you: what's the Ministry of Health? You receive donor funding and you engage in partnerships with different players. How, as a ministry, do you ensure that you attract a common development interest, both internally within the ministry, and then also in regards to the partnerships that you engage in?
Okay, so thank you very much, Malu. Good afternoon, distinguished guests. So for us in Ghana, within the framework of Global Health Agenda, focusing on universal health coverage and sustainable development goals, is anchored our national health policy and also our health sector medium-term development plan. Just like other health sectors, we have a pluralistic sector with a diverse range of partners that we engage. So private sector, development partners, other government agencies, and civil society, as you just mentioned. This we do because we realize that government cannot do it all. And so we engage in these partnerships to ensure that we maximize the achievement of our health goals. We also recognize the immense role that our partners play, especially in areas of resource mobilization, advocacy, budgetary support, capacity building, amongst others. And so what we have done is that in developing our medium-term priorities and policies and plans, in addition to many others, we jointly develop these with our partners to promote synergies in our actions and also to ensure a common understanding of our priorities and goals. We also realize that attracting the common development interests goes both ways for government and our partners. And so the different components of our priorities and these engagements, different partners are able to align and also tap into their areas of interest and creating a win-win situation for us all. As the ministry, we have prioritized and institutionalize some of these partner engagement processes, with the partnership being delivered through various mechanisms in the health sector. And so, for instance, we have common management arrangements that establish the collaborative and coordination arrangements. And these include the interrelationships, the roles and responsibilities within the health sector. We also have the Health Sector Working Group forum that provides the platform for effective engagement between the ministry and our partners, especially in the area of policy dialogue, amongst others. And then the inter-agency coordinating committees, which is also a multi-partner, which are multi-partner committees, also provide a forum for us to facilitate discussions on technical issues related to certain diseases or thematic areas. We also have annual health summits. These bring together all our partners to discuss our sector performance, as well as agree on our sector priorities. And a major product from our annual health summit is an aid memoir, which outlines the key decisions that have been taken during the summit. And this is jointly signed by government and our development partners. And it's critically monitored to ensure that those decisions are implemented during the year. We also undertake joint monitoring activities with our partners and for us to assess implementation of our programs. And so these are some of the things that we have been doing. These notwithstanding, there are some challenges that as a sector, I think we sometimes face, not all the time. And so there may sometimes are issues of multiplicity of donor or partner interest. And so sometimes the partner priority may not align to the national priority, and it becomes a challenge for us. And sometimes too, the there's a lack of a holistic view of what is actually happening in terms of the different partnerships and the available resources, because then you have partners sometimes going down to the sub-national level on the blind eye of the national level. And so you're not able to capture a holistic view of the partnerships that are available. And the other challenge that I'd also want to talk about is the sustainability of our programs, of some, not all. So if we don't build in the sustainability measures, I think this was mentioned by Ian, it becomes difficult to continue with some of these programs. And so once the donor funding is withdrawn, momentum is lost. And sometimes brilliant initiatives just die because of the lack of sustainability measures being added on. And then for Ghana, with our attainment of lower middle income status, we have faced some challenges of donors withdrawing funding. I know we shouldn't be too donor dependent, but this also creates a challenge for us to sustain the investments that have already been made. We have also received technical assistance in the past, and not all of these translate into knowledge transfer. And so sometimes some of these TAs just end once the programs end. And so there should be a way of transferring the knowledge and then adding on to the existing pool of knowledge to ensure that there is sustainability in country. The other major thing for us is also around the private sector, which we keep saying is fragmented. Even though for us in Ghana, they are organized around associations, we are still working towards getting a unified voice for the private sector. I'm aware the Private Health Sector Alliance of Ghana is being revamped to actually take up this responsibility so that they can effectively engage government. And so for us in Ghana, these are some of the challenges that I think we are experiencing. I don't know if I should go into how to mitigate some of these, or this will come up later.
Yeah. Challenges are always better with solutions.
Okay. So for us, I think that as stakeholders, we should all be committed to workable governance structures. And so, for instance, for us in Ghana, the common management arrangement that guides these relationships, and we should have to ensure that we all as partners adhere to the CMA. We also need to ensure that our donor-funded programs are designed to utilize existing in-country structures so that this will enable us building more sustainability and also create the level of ownership that we need. Systems for comprehensive tracking of partnerships should also be in place. And so not just capturing partnerships that are happening at the national level, but also down to the subnational level. And this will give us the holistic picture of exactly what is going on in country. And then also for us as government to continue to advocate for a unified voice for the private sector. And finally, I think we should also showcase some of the success stories so that then this would also get other partners to realize the benefits of this coming on board. And I think I'll end here for now, and then if there are questions, I'll take that. Thank you very much.
Thank you. Out of curiosity, from Ministry of Health perspective in Ghana, what are some of the key qualities or characteristics that you think your ministry can benefit from in terms of partnership with the private sector? What are some of the private sector traits that you would like to benefit from in a partnership?
Okay. So for the private sector, I know most of we have to look at the market orientation of the private sector and not just operate as government, but look at the business side of doing things. And I think that would also help us. So not doing business as usual, but looking at the business side of doing things and how this can affect the market and impact on the quality of life of everybody.
So the business skills, maybe the efficiency, effectiveness part, learning business management.
The bureaucracies.
Yeah. Okay. Interesting. And you mentioned that there is some private sector unification in the health space going on in Ghana, but not yet to the level that you can say it's a unified voice and easy for you to, as a ministry, to engage with. What do you think is needed for that to be happening or to be stronger?
Okay. So as I mentioned, so around the individual associations, they are very well organized. So it is unification that is currently ongoing. And I think with a lot of government support, which we are backing them with, and then also be able to mobilize resources from within to actually effectively do this engagement process, I think it will be very helpful for all of us.
That's very useful. And I think that's also a key point that you mentioned, mobilizing resources also for the private sector to unite. We know because AHB, we do quite some work in helping private sector to unite and to come together and create a unified voice. And you have federations with membership fees, but those are not enough. Those alone are not enough to sustain a federation and the advocacy and the lobbying and the meeting activities that are needed. And often, or actually I believe in all cases in Africa, all the healthcare federations that are the unified healthcare federations at national level, they have voluntary boards and they have a secretariat under that's usually funded by management or by the membership fees, but it's a very small budget and everybody's volunteering their time because they are running full-time businesses in their own companies. Exactly. So I think is really key. It's not only a resource mobilization for government side, but also actually for private sector side to make sure that they can create the muscle and the team together to actually also drive the agenda together with the ministry to the next level in terms of partnerships and PPD, PPB. So yes, thank you very much. I would like to leave it at this, but I'm very sure there will be questions for you in the Q&A section. For now, I would like to thank you very much, and I'm going to collect some questions from the audience. So thank you very much, Dr. Marty, and I'll talk to you later. Let's move to the Q&A section now. Let me see, I've gotten some questions here. My first one is for Barbara, for Sanofi Pasteur. Barbara, do you have any ongoing or future projects in Africa in the upcoming years? This question is asked by Ahmed Kapsi, sorry.
Can you hear me again? Yes.
Shall I repeat the question?
No. I got the question. You can hear me correctly. Okay. Yeah. Yes. So thank you for this question. So first, I think it's important to say indeed that all the partnerships that I mentioned earlier in the session were partnerships that started sometimes, as I said, a couple of decades ago or a couple of years ago, but are still ongoing. So both with the global partners, the regional one, and the local one, and of course we are considering to expand those partnerships. So for instance, with BioVac, we are in constant discussion on the building capacity. There was also the presidential visit recently in South Africa, where I think it's important that we also mentioned that we will keep working with this partner. We are also in discussion with on clinical trials, as I also mentioned on the continent. So it's still a long-term commitment.
Great, good to know. Then let me move to the next question. It's for you, Ian, and actually two people asked questions to you in the same type of question, only for different countries. Any plans for Labs for Life to come to Nigeria? And that same question also in regards to Tanzania.
Yeah, so right now there are no immediate plans in Labs for Life, so that those discussions haven't been held. But we do have other programs which we're embarking on across Africa. We run, especially I think in the AMR space, we're running an AMR scorecard with ministries of health that covers countries in both Southern Africa, East and West Africa. We also have projects, as I said, in infection prevention and control. One project specifically in Kenya right now. So I cannot speak at the moment specifically for Labs for Life for Tanzania as well as Nigeria, but there are other programs that we have, and maybe those that have asked the questions can reach out to me separately.
Okay, great. So Agama from Lagos and Jacinta Ferentinos, please feel free to reach out to us and then we can connect you to Ian. Ian, another question for you in regards to the Labs for Life project. How does this represent the shared value approach that enhances the business value as well, or increases BD's competitive advantage? This aspect is important to ensure sustainability of such partnership efforts. This question is by P.L. Bolton.
I think the shared valued approach, where sort of doing well by doing good, is really critical from our approach. And I think within those specific areas, for example, in the Ethiopian example, if you're having a country from a capacitation point in having a better transport network, it means more patients, samples can get to central sites. And if you're happening to be playing in the space, there's an opportunity from a business point of view. But I think the foundation where we started these areas, or some of these focus areas, are about increasing diagnostic capacity in country. If you are a player in the diagnostic space and a country has a lab system, can deliver better quality results with better, I would say, trust from clinicians within the space, that opens the broader diagnostic space within countries, allowing better treatment for patients, but does create opportunities for companies commercially operating in that space.
Okay, and then one more question for you, Ian. From Maria Georgievich. Can you comment on awareness of the role and structures enabling access to diagnostics and other medical technologies in relation to African health challenges?
I would say, I think globally, the level of access and infrastructure is probably, the level of awareness is not there. And I think it's probably an area of less focus. For example, if you just purely take right now the area around the COVID pandemic, very much we're focusing on the vaccine. At the back end of that is really about what is it, the lack of diagnostic capacity within Africa means many patients were left undiagnosed, increasing the rates of transmission within countries. So for me, there's often a disconnect, and we're often focusing on the therapies, but not necessarily enough on the diagnosis. Because when you have a diagnosed patient, you can have a much more targeted approach in terms of where your therapies need to go to introduce and improve care. So while vaccinations are important, it's the underlying impacts with regards to that. I think I'll just give you an interesting side note. In some of the, for example, these public-private partnerships in the vaccine space, BD is the largest needle and syringe provider globally, and also in the pre-fillable space. So often in the back end of the vaccine production, where you have these tech transfers, the devices that often many of these vaccines sit in are often a BD device. So we do see ourselves as an end-to-end player across the value chain from a medical device diagnostic space, but also partnering with the pharmaceutical companies in many spaces. But I think globally, we have pharmaceuticals very visible, diagnostics, medical therapeutics, medical devices, which are critical to deliver of hard care. It's probably not where it needs to be from a total Africa point of view and adoption. And the more integrated approach we have within that space, the better care and delivery will happen going forward. But that's critically why these partnerships are so key for us.
Okay, that's very clear. Thank you, Ian. And I would like to move to you, Karim. Question from Sylvia Mikalo. What would be the three main lines of partnerships between health tech services provision and healthcare authorities in Europe and Africa?
Very good. Let's go first for the one related to healthcare authorities and between Europe and Africa. I mean, in Africa, we are trying to build a solid and sustainable regulatory system. And this is the AMA that I had mentioned during my talk. And 2 days ago, we got quite a really strong and solid support from the EMA, the European Medicine Agency, to support the creation of EMA and also supporting all this capacity advancement which are required to build such a big agency. it is clear now that there is a strong involvement of Europe to make things happening and supporting. It's good also, very good for us, very good energy. What was the other question, Carlos?
What would be the 3 main lines of partnerships between health tech services provision and healthcare authorities? So 3 main partnership lines or partnerships ways, I think that's what, partnership areas, that's how I interpret the question.
I mean, we need to reimagine our health systems in Africa. Therefore, we need to reshape also the healthcare strategy of almost each and every 55 countries. So without this partnership, we'll not be able to digitalize, which is part of the solution, digitalize our health system. Will not be part to organize all this tech transfer which are required. So, I mean, the answer is in the question.
Clear. Sometimes that's true indeed, and I think this case also can be also, yeah, it's a clear. I would like to move to USAID. I have some questions for USAID as well. The first one is from Tamiro Demeke. It's a long question, so please bear with me. The public-private partnership in the health sector is important, not only to increase health coverage, but also to make healthcare services affordable, especially for poor people who cannot be enrolled in health insurance. In my opinion, the strength of a PPP will make Africa free from donor dependence. But my question is, though USAID made some effort in enhancing PPP initiatives, to what extent has USAID become successful in this regard? So I understand the question is USAID has been supporting PPP and PPD dialogues in quite some way. And the strength of that would be to become donor dependent. In how far, in USAID's views, has Africa succeeded with the support also received from a donor, USAID?
Yeah, I mean, I think that a couple of the examples that we gave today are good examples of ways that donor funding can be catalytic and enable these initiatives to be sustainable. I think the Project Last Mile initiative has been one of the big successes. The example that we gave earlier, all of the companies that were supported through the FCDO funding are now continuing to produce PPE, so we're able to pivot successfully. So I do think that when combined with private sector capital for leverage, I think that these PPPs can be quite sustainable. Ishrat, I don't know if you want to add anything.
Yes, I would like to add that USAID also has been working with other donors to help government adopt sustainability as a part of the goal as well as the policies. So this is part of the continuous dialogue, not only between USAID, but USAID, other donors, and the countries concerned.
That's a clear answer. Thank you, ladies. I have another one for you. Again, a long one. I don't know which country it is, but Tamiro Demeke asks, in my country, the private health facilities charges for treatment of COVID-19 have become unacceptably too high. And as a result of this, patients are discouraged to go to these facilities and in return are forced to go to public health facilities to treat many patients more than their capacity. And consequently, patients are forced to treat themselves in their home. The question is, to what extent does the support of USAID alleviate such problems in countries where you provide support? So help to share the burden or reduce or subsidize the public sector or, yeah.
Yeah, Emily, you were going to say something?
You can go ahead.
Okay, so what I wanted to say is this, that this is the constant part of the dialogue, affordability, outreach, equity. And to the extent that this is leading to inequities, I'm sure that in the respective countries, this will be part of the discussions with the government, because that is something which is very important for USAID development efforts.
Yeah, and the other thing I'll add is the team that I'm a part of, the Center for Innovation and Impact. One of the things that we think about are what innovations we can support to help strengthen the health system writ large. In particular, our digital health team is interested in how we can build those digital health ecosystems. And I think that support helps to improve the efficiency and affordability of the sector by allowing patients to access the system in different ways, through digital channels, so that they are, for example, they don't need to go to the clinic in person, or that they can receive care in a more timely manner, before they have symptoms that are, require an emergency situation. And so I think that's another way that we help support, affordability is through these investments in digital health.
That's great. Thank you very much. I have one more question for Dr. Marty. Dr. Marty, what is the role of the broader population or general population in instituting sustainable healthcare systems on the continent?
Okay. So I would say that their role is very key at the community level. So it's important to engage the population at the community level and ensure that they buy into the programs. And so for us, for instance, for us in Ghana, we have the health management teams at the community level, and they jointly plan some of the health programs at that level. And so if we do that, we can add up into getting a broader mass, a bigger mass, accepting our health programs.
Great, very, very clear. And indeed, the community is key. And in the end, what are we doing all this health for? Public, private, in the end, we are not a private person or a public person. In the end, we are people and we are a community. And I think great answer in terms of population. The community is key, especially here on the African continent. So thank you for that answer. I need to close the Q&A section because we will otherwise run out of time. Thank you, everybody, for your questions and answers as well. Before we move to the parting shots, I would like to move to the results of the poll questions. Can we go to that slide, please? Yes. The first question was, in what way do development partners add most value into the development of Africa's healthcare sector? The provision of financing is answered mostly by all of you, followed by the provision of knowledge. So financing is still, money makes the world go round, right? So I guess that's what we acknowledge in this answer. The second question that we asked is, which of the below subsectors in the African healthcare space would lend itself best to spearhead improved health outcomes under the auspices of a PPP? If we look here, we see governance is the highest, followed by service delivery. So good governance is including all different partners to make sure you have ownership, buy-in, awareness, and trust to move together to the next level and create more impact and results. I think that's the overall feedback that I get out of this answer. Let's go to the last question. At which level do you believe partnerships in health in Africa would be most effective and efficient and achieve most impact? The national level. Interesting to see that continental level is rated very low. I think this gives the view that Africa is a continent, but internally it's also very diverse. So we also need to encourage or acknowledge that those diversities at a country level by moving first place in terms of PPPs and partnerships to a national level, followed by regional level as well, and subnational, of course. So thank you for these answers. Then I would like to move to the parting shots of all our excellent panelists that we have had. Unfortunately, Dr. Wilhelmina Jalla was not able to join us due to urgent commitment at the ministry, which disabled her. You know, people in her position are called into very important meetings last minute. So we excuse her and appreciate the commitment that she made to be here, but circumstances took over. I would like to give you all panelists 1 minute for some reflections or key takeaways. Try to keep it 1 minute. Barbara, I'd like to start with you. What is your key takeaway or part at the end of this session?
Thank you so much first for allowing me to be part of this discussion. I think it was tremendous to see the amount of partnerships already existing on the continent and on regionally and locally. And also, as Karim mentioned, I think it's only by partnering that we will be able to improve. I think there's the saying in Africa that alone we go fast and together we go far. It's very inspirational and provides also food for thought for us and our organization to keep playing our part and keep raising the bar as well.
Thank you, Barbara. Karim, please delight us with your 1 minute takeaway or parting shot.
Thank you, Maraz. First of all, I would like to comment on the continental aspect and the outcome of the.
Thank you, Anne.
Yeah. I don't agree at all. I mean, we are seeing this free trade continental agreement progressing quite fastly for me. I've seen already since January several shipments moving from Ghana to Ethiopia, which is not the easiest country in terms of custom barriers, and we see things moving. We have this AMA also progressing. So yes, the continent will be very soon less fragmented. We see a defrag. I see a defrag, and I'm not that optimistic, but we see a defrag, and we have to believe in our continent. It's about 1.2 billion population, and it's one of the strongest continent ever, and one of the most dynamic. And again, my last message: this is for all the key stakeholders and decision makers. Health is not a cost; it's an investment. Thank you.
Great, so true. Nothing to say about that. Ian, please share with us your last parting shot.
I think, firstly, again, thanks for being part of the panel this afternoon. It's been really insightful to listen to the viewpoints of others. But I think COVID has put healthcare front of center globally, but it's also in Africa. And it's highlighted our gaps, it's highlighted our needs. And I think to address that, I think through what many of the panelists have mentioned, where it's local production, where it's kind of uniform regulations of the continent, I think partnerships are part of that in terms of addressing that need, because funding alone doesn't address the healthcare gap. It's about capacitation. And I think it's something that we can do together, but we need to align to walk that path together going forward. Thank you.
Thank you very much. Ishrat, what would be your parting shot following this session? You're on mute, I believe.
I was very encouraged by the discussion today. It was very inspiring and encouraging. And I also feel that COVID has shown the importance of the private-public partnership, and that is what is happening as far as the thinking and the policies and the actual practice in the countries are concerned. And it is the time to build upon that and create long-term relationship and partnerships.
Great. The right momentum is there. Thank you very much. Emily, please share with us your final thoughts.
Thank you. I just want to thank you and all of the other panelists for allowing me to join today. It's been really inspiring. I think this just really underscores how necessary public-private partnerships are. And I think particularly from our perspective, we really deeply believe that the public sector and the philanthropic sector cannot do this alone. Grant capital is just one drop in the bucket compared to private sources of capital. and really believe that, together it's the way it's most powerful. And so really see the private sector as key, both in healthcare provision and also scaling access to healthcare. So thank you.
Great, thank you very much, Emily. Dr. Marti, please share with us your last, or not last, but your final reflections.
Okay, thank you, Marlo. I also appreciate being part of this very inspiring process. It's been very useful. I would want to say that as partners, we should always look at the overall country priorities and see where we strategically fit in, and then jointly we can develop and build our health programs to meet our objectives. And so let's co-create, let's co-develop, and let's co-produce. Thank you.
Great, thank you. So partnership right from the beginning to develop the co-creation process towards solutions. Thank you very much, everybody. I would like to thank all the panelists for their time, their enthusiasm, and their key insights that have made this session to what it was. I hope it was insightful for all the participants. For me, for sure it was. Before we end, I would like to thank all our event partners that make our AHBS series this year possible. You see all the partners that we have this year on this slide. And then I would also like to draw your attention to the next webinar that we're having in September. That's going to be about healthcare policy harmonization and collaboration amongst governments. You'll see here the speakers we have confirmed for the next session. And Amit, our chairman, will be the moderator of that session. And then there's another announcement I would like to make, or a save the date I would like to share. For next year, 24th of February 2022, it's a Thursday. We are going to do something new under the Africa Health Business Symposium. We're going to create a thematic full day focused only on Africa Women's Health. So we have called it the Africa Women's Health Day. And we're going to further explore the role of the private sector in advancing women's health in Africa. And we're currently still developing the program, the layout. It's going to be a hybrid event, so physically and both online. We hope that by that time physical meetings are possible again, even though they will be smaller than our regular AHBS. But we're planning to hold the event in Nairobi, but also make it available online so that people from far who are not able to travel can also join. So please save the date. And if you are keen to already brainstorm with us about what the content should be like or partnership could look like, feel free to reach out to me or our team. But please save the date, and more information on this day and program and all that partnership opportunities, collaboration areas will be followed and shared with our team. But for now, I wanted to share the save the date with you. Also, in terms of other partnership opportunities to honor our team, reach out to us. We do a lot more than only this curation of Africa Health Business Symposium. We are doing a lot of technical advisory, research, project implementation. So feel free to reach out to me or my team and brainstorm with us how we can help you advance your goals and objectives in the health space in Africa to the next level. Leaves me nothing but to thank everybody for their time and commitment and interest and overall love for improving health for everybody here on this great African continent. So thank you, everybody, and looking forward to seeing you back in September. And we can engage offline as well. So thanks, everybody. Have a good evening, rest of your morning or afternoon ahead. Thanks, everybody, and take care.